The diagnostic aid that is used for measuring the transverse discrepancy as well as the vertical facial dimensions are PSF, lateral ceph, OPG or occipitomental. So these are all the different radiographs. Okay, and to answer this question, we need to know the views of this radiograph and their indications. Okay, now cephalograms are basically radiographs of the entire face. They can be of two types. Okay, that is from two different views they can be taken. Either they can be taken from the frontal view, that is the PSF, okay, or it can be taken from the sagittal aspect or the lateral view, that is the lateral ceph. Now, when you do a PSF, that is from the frontal aspect, here the type of measurements that you can do are measurements in the transverse and the vertical planes. Okay, so here what you see, these landmarks which are given, so here you can measure the dental landmarks. Okay, so the transverse measurements of the dental or transverse discrepancy in the dental as well as skeletal. So these J points, they are denoting the maxillary base. So any transverse discrepancy in the maxillary skeletal base or the maxillary dental dentition as well as mandibular dentition and mandibular skeletal base can be assessed, along with vertical measurements that can be done. So here you can see that there is an orbit, there is the nasal bone, nasal septum, the mandibular condyle, the maxillary base. So all of this can be visualized on the PSF. So these vertical values can also be assessed. Now the PSF is usually indicated in those situations where there is a facial asymmetry. Okay, so asymmetry is very clearly identified on the PSF, as well as when there is a maxillary transverse discrepancy. So in those cases where there is a narrow maxillary arch and we want to do a rapid maxillary expansion, so to check the discrepancy, this can also be assessed on the PSF. Whereas the lateral ceph, now here this is taken from a lateral view. So here mostly we can measure the dimensions that are seen in the sagittal view or the sagittal plane as well as the vertical plane. Okay, so here you can see there's the cranial base, the maxillary dentition, mandibular dentition and mandibular skeletal bases can be identified. So on the basis of these landmarks, we can check the anterior-posterior discrepancy between these skeletal and dental landmarks. So we can identify on the basis of how prognathic or retrognathic the position of the maxilla and the mandible is, and this helps us to identify whether the patient has a class 1 skeletal base, class 2 or a class 3 skeletal base, and also the inclination and position of the teeth, if there is proclined incisors or retroclined incisors, and also somehow a little bit of the molar relation can be assessed. In the vertical aspect, we can measure the vertical values as well as the growth pattern of the patient on the base of the mandibular plane, whether the patient is a vertical grower, horizontal grower, etc. So this is the cephalograms. Okay. Now next is the OPG. Now OPG is again a frontal view where the entire dentition, that is the maxillary as well as mandibular dentition along with the basal bone, is visible. So any gross pathology that is present, such as any cysts, any tumors that is dental related, can be assessed on the OPG. Okay, one important feature about the OPG that is helpful from orthodontics point of view is during the mixed dentition. Okay, during the mixed dentition, we can assess the root development of the individual teeth, and we can see we can try to approximate when the tooth is going to exfoliate, when the deciduous tooth will exfoliate, or when the permanent tooth is going to erupt. Also, if there is any impacted teeth, then their position and their probability of eruption can be identified from an OPG. Also, the health of the mandibular condyles can be assessed on the OPG, and the root shape and size can also be assessed. So that is also very helpful. If there is any dilaceration of the root, etc., that can be visualized. So it helps to give a complete picture of the entire maxillary dentition on a single radiograph. So it's a very helpful, and this is an essential diagnostic aid. So the cephalograms are non-essential, meaning they are not necessary to be taken before the pre-treatment records. But an OPG is an essential diagnostic aid, and this needs to be taken before you start any orthodontic therapy. Now the problem with the OPG and as to why we cannot do any calculations or measurements the way we can do on a PSF or a lateral ceph is that there is a lot of magnification and distortion errors that are seen on a OPG, especially in the midline structures. So these structures get magnified unequally. So they get magnified more than the lateral structures. So because of this difference in magnification, it is not a good radiograph to do any measurements on. Okay, so this is helpful for viewing or the dentition, the status of the dentition and any pathologies that are associated with the dentition and the basal bone. Now the final option that was mentioned was the occipitomental view. Okay, occipitomental, this is also known as Waters view. So as you can see, this looks like a PSF, but it's slightly different because it is angulated. Okay, so the PSF is straight because the patient is looking parallel to the FH plane. But in the occipitomental view or the Waters view, the patient is angulated at a 45 degrees. Okay, so this type of view is actually indicated when you want to visualize the sinuses of the facial skeleton. So the maxillary sinus, the frontal sinus, the sphenoid sinus, the ethmoid air cells. So all of these can be visualized on the single radiograph. So this is helpful when you want to or indicated when you want to assess the sinuses of the skeleton. Okay, so the answer here is the type of radiograph which is going to help us to measure both transverse as well as vertical is the PSF. So the answer here is PSF. Now there are two analyses which are important to know in the PSF, so that is the Ricketts analysis. So along with the normal lateral cephalometric analysis that was given by Ricketts and the Ricketts VTO, he also gave a analysis for the PSF. And the second is the Grumman's analysis. So these are the two analyses that you need to remember about the PSF.